Checklists: Keys to Safer Diving by Shabar Ranapurwala. In the past 20 years, diving injuries and fatalities have declined, even as participation in scuba diving has increased. This decline can be attributed to better training, equipment, research, and access to healthcare. With the increase in participation, there exists a need for continued improvement in diver safety. DAN research is an important part of the effort to enhance divers' understanding of the risks, promote better protocols, and raise safety awareness in the diving community. We know that the most common cause of diving fatalities are drowning, arterial gas embolism, and cardiac incidents. The majority of these deaths are labeled as drowning, but most experts believe that drowning is usually preceded by some other debilitating injury. In the 2008 DAN study, investigating 947 diving deaths, it suggested a common chain of events in these deaths: a triggering event, a disabling agent, a disabling injury, and then ultimately the cause of death. In an earlier study, researchers used a similar approach to review all work-related deaths in Australia that occurred between 1982 and 1984. They identified precursor events and contributing factors. Both these studies concluded that prevention strategies aimed at reducing triggers and precursor events could reduce injuries and fatalities. It is not so easy to look back at accidents and establish their root causes, but this approach allowed the authors of both studies to conclude most accidents are caused by preventable mishaps, unplanned and unwanted events that increase the risk of injury. The mishaps identified in both studies could be categorized as human errors, equipment problems, or environmental factors. The most common diving mishaps were out-of-air scenarios, rapid ascents, equipment problems, and entrapment. Reducing mishaps, especially human error and equipment problems, therefore seems to be the key to decreasing injuries and fatalities. One way to reduce mishaps is to remember important safety procedures that follow them. Avoiding, omitting, neglecting, or failing to understand the importance of such procedures leads to human errors. These errors can compound with increasing stress, difficult to operate, or malfunctioning equipment and environmental challenges. A checklist is therefore a handy tool for reducing errors, improving performance, and meeting safety standards. Checklists have proven to be effective in many high-risk disciplines, including aviation and surgery. In aviation, their use is well enforced. Pilots and crews of military and commercial aircraft all have checklists for various procedures, and they must adhere to them, complete them, and submit them. The World Health Organization has also promoted surgical checklists for the past 4 years. They have been found to reduce deaths and complications by streamlining communication amongst surgical teams and hospital staff. The benefits of using checklists has also been demonstrated in recreational settings. A program called Bikes, Blades and Boards conducted at Hamilton Health Sciences in Hamilton, Ontario, judged children's performance wearing helmets using a helmet checklist and addressed mishaps related to fit, adjustment, and condition of helmets. Children who participated in the program and used the checklist scored better in helmet use than children who did not. The experimental group retained the helmet using skills even a year after the intervention. What about diving? Well, standard pre-dive procedures includes a review of equipment, the dive plan, and response to unplanned events. We hypothesize that the use of a pre-dive checklist will reinforce these steps and reduce mishaps related to human error and equipment problems. Such reinforcement may be especially important in recreational diving because of the long interval that many divers have between dives, frequently months or even years. Checklists have a long history in diving. US Navy divers employ a thorough pre-dive checklist before dives, and compliance is strictly regulated. PADI uses the acronym BWRAF, BWRAF, when teaching pre-dive checks to recreational divers. The acronym stands for BCD, weights, releases, air, and final OK. Many mnemonics are used, also including the well-known BWRAF and colorful varieties of other ones. The acronym has made its way into many mnemonics, including the well-known Begin with Review and Friend for BWRAF. The NAUI Diving Manual features various checklists, including the one using the acronym CBAG for Sight, Emergency, Activity, Buoyancy, Air, and Gear and Go. The intent of this on-site checklist is similar to that of any other pre-dive checklist, but also provides a general review of the safety considerations rather than a general step-by-step list of tasks to complete. The American Academy of Underwater Sciences also advises divers to conduct a pre-dive check and provides a format in its manual. Divers who are trained to conduct pre-dive checklists may acknowledge the benefits of these checklists, but compliance is questionable. So the extent to which any of these checklists are actually used is unknown, and therefore there are no formal evaluations regarding their efficacy. How could a pre-dive checklist be evaluated? Since there's no gold standard, it would start with input by dive medicine researchers, instructors, and physicians trained in diving medicine, together with diver medical technicians. There is no gold standard of pre-dive checklists. So, with input from dive medicine researchers, diving instructors, physicians trained in diving medicine, dive medical technicians, Dan developed a pre-dive checklist for evaluation. It was pre-tested on 16 divers in a field setting to ensure clarity of content, assess the effort involved in completion, and determine the acceptability of the checklist to divers. To evaluate the effectiveness, Dan conducted an intervention trial in the summer of 2012. The intervention groups of divers used Dan's pre-dive checklist, while the control group did not. At the end of each dive day, researchers asked all divers to complete a questionnaire about diving mishaps. The data were collected and are currently being analyzed. The incidence of mishaps between the groups will then be compared. The study is still in progress. If, as suggested, checklists promote closer adherence to safety guidelines, as we hypothesize, the primary benefits will be a decrease in mishaps related to equipment and human error, and a consequent reduction in the incidence of injuries. Additional benefits from public health perspectives may include a decrease in the financial burden of treatment costs, a reduction of lost productive time due to injury, disability, and death, and safer, more enjoyable experience for divers. Additional benefits from a public health perspective may include a decrease in the financial burden of treatment costs and a reduction in lost productive time due to injury, disability, or death, and safer, more enjoyable experience for divers.